Okay, go for it.
Right, so I've suffered with migraine since the age of 10. They all started around about the age of 10. I had full migraine attacks with basically with an aura. So they were full aura, sickness. So I would get full blindness, sickness, complete pain. I'd have to be in a room to the point I'd be bashing my head against the wall. I'd be in that room for a full day. That would continue with a headache that would last from 2 to 3 days. So I'd literally be off of school for 3 days. So that would be excruciating pain. That went on up until about the age of 18. About the age of 18, the attacks subsided, and then they would probably would only happen about every 4 or 6 months. They seemed to calm down. There was history in my family, my mother and also my grandmother as well, so we did have some family history of migraines. Then things calmed down, and in about between 1997 and 2002 I would have occasional migraine attacks, but what happened, things changed slightly where I would just have isolated auras. So all I would have then would just be partial loss of sight. The loss of sight would just be across my right eye, and I'd get some facial numbness as well. But there'd be no headache, so I'd just lose my sight across my right eye and some facial numbness. I was concerned about that, so obviously I had my eyes tested, but this seemed to be put down to migraines. Then in 2002 I started to get cluster headaches, and that meant I'd get constant pain for any period of between 3 and 4 weeks at a time. This went on constantly to the point I was in excruciating pain, and I actually took myself to A&E, and then I was referred to Dr. Watts, a neurologist at Luton Dunstable Hospital, where I was obviously looked at for migraine treatment, and I was given propranolol. Treated with propranolol for a while, and they seemed to control the migraine and calm them down for several years, and they worked quite well. So previous to that I was actually given amitriptyline, which is an antidepressant. Amitriptyline obviously gave me very bad side effects. It seemed to actually work in reverse to an antidepressant, and it was very bad for me. So obviously I came off that. Then I went on to the propranolol, and the propranolol was a beta blocker, and that worked really well, and that really calmed down my headaches really well, and I'd still get the odd migraine every 3-4 months. So that worked really well for me, and that went on for several years. And then in about 2008 I developed severe facial pain. Just out of the blue I got burning sensations right across my face, up my head, down the back of my neck, to the point I was in agony and screaming. It's like someone had stuck my face into a fire, and I was literally felt like I was on fire. I went to see my dentist because I'd had a spell of ear infection, and there was pain all around my face, so we were looking at ear infection and stuff. I'd had all that treated. So there's problems with an ear infection. Obviously I'd had an abscess as well, so that was treated. The first thing was from dentist thoughts that I had neuralgia. I was started on pregabalin because they presumed I had neuralgia, and I was then referred to the maxillofacial unit at L&D Hospital. The L&D Hospital didn't feel it was neuralgia. They felt there was a jaw problem, and they gave me a splint to use. To be honest, the treatment I got at L&D Hospital was pretty poor, and after 2 months they just sent me away and said go back to your GP and have some treatment for pain relief. They wasn't interested in treating me. So I went back to my GP. Shortly after that I was sent to the National Hospital Queen's Square in London. I was given a diagnosis of chronic idiopathic facial pain. For most people that just means we don't know what the pain is, but it's very painful. And I was treated with a course of escitalopram, which is another antidepressant. Things seemed to sort of rear up and calm down, didn't really give me any benefit, and I was on those for quite a while. In 2012 I developed tinnitus as well, which was another side effect of the pain. So I was getting constant ringing in the ears, and I was sent back to the Luton Dunstable Hospital. So I had a scan to check my ears to see if there was any problem. That was then put down to the migraine as well. And in 2013 my dentist identified that I had TMJ issues, bite issues. He believed this was contributing to the pain in my head and to the migraine. So he then referred myself to Clina Panchal to come and have some, obviously to have a look at my jaw and see if she could help with some physiotherapy regarding my TMJ. With my neurologist, some of the treatments I've had obviously over time is pizotifen. That's one thing I didn't mention, obviously in the past. He had a look at that. There was also naproxen, which didn't obviously give me much benefit. Currently I'm on 75 milligrams of topiramate in the morning and the evening, which I'm just about tolerating, but that obviously gives me quite bad side effects of pins and needles. It has calmed down slightly. He also gives me 100 milligrams of sumatriptan and 1 gram of naproxen, which I can take when the migraines come on strongly. The situation I'm in at the moment, as far as the migraines goes, I say I've been pretty much at the end of my tether as far as pain's going. Average over most of my time, I'd say my pain was sitting at sort of, when I first met Clina, was around about, I'd say a lot of the time saying 7s and peaking at 8s and 9s when I'm in pain and having to take sumatriptan. Over the last few weeks I've been sitting at lots of 8s and 9s constantly. That has meant that I've had to go back to my GP, and we have looked at putting myself on, I just forgot what the tablet's called. Just going to update on what that is. Nortriptyline. So I've been on 10 milligrams of nortriptyline, which is an antidepressant, which is helping for the migraine, and obviously because I have been going through some depression because of the pain. I've now just stepped up to 20 milligrams in view of in a week's time being on 25. So that is obviously to help with, along with the topiramate for the migraine and for the depression side effects as well. That was advised by a gentleman that I saw at the National Migraine Centre that I went and saw independently, as advised by Clina. She asked me to go and see him as well, because I felt at the time that the neurologist I was seeing, I was unhappy by the service I was getting, so I went and got the independent report by the National Migraine Centre, and I'm currently waiting for an appointment in December by another neurologist that I want to go and see as well. Basically, the pain is very tedious. It's very hard when you're living with pain day in, day out, putting up with it for years. So,
how's it been affecting your home and work life?
Very stressful, very tiring, very hard with work, that I've had to step down from a role as a store manager within Wix. There was talk of me having to go to a part-time role because I've struggled with my job and holding down my family. I've managed to get back to a full-time role, but I've had to step down to a deputy store manager's role. But that has affected my family because all my efforts are put into my work, that by the time I get home I'm absolutely knackered and struggling to spend quality time with family because I'm in pain and I'm tired when I get home. And it has meant that I've become depressed. The only saving grace I've really had is obviously the fact that my dentist obviously advised myself to come to yourself, Karina, and some of the treatment that I've obviously had here has helped, and your advice has obviously get me to go to the National Migraine Centre to get some independent reports to try and help myself. One thing I haven't mentioned obviously is that I managed to finally get the greater occipital nerve block 4 weeks ago, and I've got a follow-up in 3 weeks' time. That hasn't really helped us yet, but we keep pushing on with that. And maybe if that doesn't work, then maybe there's an option of other treatment if we keep pushing on, but it's very hard under the NHS, you know, and obviously I can't afford to go private. Last week the nortriptyline seems to have helped with some of the pain and with some of my moods. Last week the infrared treatment that we had, that you gave me,
The laser treatment.
The laser treatment, actually with the TMJ gave some relief, and when you used it on my headaches as well, it gave me some relief, and this is probably the best week I've had in quite a long while.
So what sort of pain scales were you in prior to the laser treatment out of 10?
When I came to see you last week,
What symptoms did you have in your face?
the face we were looking at, we were probably sitting, the week before I was sitting round about the 9s in the face, we had sat down to the 7. When I went away from here, the face did really ease off to pretty much, I could hardly feel anything in the face. I'd probably say around about 1 for the day. The next day it did pick up round about 2 or 3. After a couple of days did go back up to about 6. Maybe that's because of some of the manipulation and things obviously do have to heal themselves. The amazing thing is though, where my headaches were, is the fact I've had quite a lot of relief over the last week, and from my head, where I was sitting at 9s, I'd come down to that 7 mark. When I walked away from here last week, I was back down to about a 4 afterwards with my headaches. And my average over the last week's been a 5. When I've been sitting at 9s and 7s down to a 4 and a 5, it's a vast improvement. And I know we can look at the medication has probably helped, but there was definitely a drop for 2 days with the treatment as well. So a dramatic drop straight away with the treatment on the head as well. So that was definitely some relief for them 2 days straight away.
Okay, great. Thank you.
Okay.